If you're having radiating symptoms down your arm and hand, you could be having a cervical radiculopathy. So I'm going to show you what's known as a cluster of Wainner, which consists of 4 tests that you can do to try to determine if this is a true cervical radiculopathy. So what I'm going to do is I'm going to depress Kinsley's scapula a little bit. I'm going to bend her elbow, bring her hand up, bring her fingers out, rotate her back, and then straighten out her elbow, right? And I'm keeping her scapula kind of depressed. And I'm going to see if this reproduces the symptoms in her arm and hand. And if she says yes, then what I'm going to do is bend the elbow and back off a little bit, and then if it goes away, I'm going to have her tilt her head to the left, and then if it comes back, that would be a confirmation that is a positive upper limb tension test 1 or upper limb tension test A. The next thing we're going to do is cervical rotation. So we should have about 60 degrees of cervical rotation, which would be about your chin coming out over the middle of your collarbone. And so I would compare both sides. So Kinsley's going to turn to the right. Let's say that this is the painful side, the side she's having the symptoms. In this case, she would pass because she is greater than 60 degrees. And then she's going to go to the left. And so if she has less than that 60-degree mark, then that's going to be a positive for that test, and that's the cervical rotation. Then we're going to do the traction distraction test. So if she's actively having symptoms down the arm, you have to actively be having these symptoms in the arm and the hand. I'm going to come up just like this and pull straight up on her head. So I'm pulling up towards the ceiling just like that. And if that alleviates her symptoms, that is going to be a positive traction distraction test. And then lastly, we're going to do the Sperling's test. So we're going to say that this is going down the right arm again. I'm going to have her turn to the right a little bit. I'm going to lean her back in a little extension, and we're going to see if that reproduces her symptoms. And if it does not, I'm going to apply a little bit of overpressure down through there, and if she says yes, it increases my symptoms, that would be a positive test. And I always would check both sides to compare to make sure that it is, a true problem on the one side. So those are the 4 tests I like to do for a cervical radiculopathy. Thanks for watching.
We hope you enjoyed the video. Please make sure that you like and subscribe so you can stay up to date on all of our current content. Thanks so much.